Do we have to have intercourse exactly on ovulation day? Does heavy bleeding mean a healthy uterus? Do sexual positions affect the chances of pregnancy? Is alcohol allowed during the fertile period? Do painful periods indicate a fertility problem? Are short periods in the woman a concern? Are ovulation apps accurate? Hi, I'm Dr. Rajeev Agarwal, and in this video, I'll be busting some of the most common myths surrounding fertility and intimacy. How often should we have intercourse to get pregnant? This is probably the most common question couples ask me. The best frequency is intercourse on alternate days during the fertile period. Daily intercourse is also fine, but it does not significantly increase chances compared to alternate days. What matters is timing around ovulation, not overdoing it. So consistency beats intensity every time. Question number 2, do we have to have intercourse exactly on ovulation day? No, and this surprises many couples. The highest chances of pregnancy are actually 1 to 2 days before ovulation, not after. Sperm survive much longer than the egg. So waiting only for ovulation day can mean missing the most fertile period. Question number 3, are ovulation apps reliable? Ovulation apps are helpful, but they are estimates, not guarantees. They actually work on past cycle data and assume ovulation is predictable, which isn't always true. Apps are good for awareness, but if pregnancy isn't happening, they shouldn't be blindly trusted. Question number 4, does gym or protein supplementation harm the sperm? No. Regular exercise is actually good for the male fertility. The real problem is anabolic steroids or testosterone injections, which can shut down the sperm production. Normal protein supplementation from reliable sources does not harm sperm. So exercise is good. Shortcuts are not. Are short periods in the woman a concern? Short periods can be completely normal and by themselves don't mean a fertility problem. What matters is whether they have always been short or have become short over time. In some women, especially as age increases, shortening cycles or flow can be an early sign of declining ovarian reserve. So don't panic, but don't ignore changes either. Is ovulation pain a sure sign that ovulation has occurred? Not always. Some women do feel pain around mid-cycle, but that pain can happen before, during, or even after ovulation. Thus, ovulation pain is not really a reliable confirmation that the egg has been released. It's a clue at best, not a guarantee. Can LH kits give wrong or confusing results? Yes, LH kits can sometimes be misleading. An LH surge does not always result in ovulation. And some women have multiple LH surges in the same cycle. That's why a positive test doesn't always mean ovulation has actually happened. LH kits are useful tools, but they need correct interpretation. Does masturbation reduce sperm count or fertility? No, masturbation does not reduce fertility. Occasional ejaculation has no negative effect on sperm count or motility. This is one of the most common myths I hear, and it's simply not true. How many days of abstinence are ideal when trying to conceive? Usually, 2 or 3 days of abstinence is ideal. Longer abstinence does not always mean better sperms. In fact, very long gaps can increase dead or damaged sperms. So moderation works better than extremes. Does male age affect fertility and pregnancy outcomes? Yes, male age definitely matters, though we talk about it less. As men age, sperm quality and DNA integrity can decline. This can affect fertility and is linked to certain pregnancy and genetic risks. So fertility is not just about the female age. Does stress affect fertility or ovulation? Stress by itself rarely causes infertility, but severe or long-term stress can interfere with ovulation and sexual function. What I tell couples is this: stress may not be the cause, but it can definitely be an aggravating factor. Thus, managing the stress helps overall health. But blaming yourself for infertility because of stress is not fair or accurate. Is coffee harmful when trying to conceive? No, coffee is definitely not forbidden. Moderate amount of caffeine intake is considered safe when trying to conceive. Problems arise only with excessive consumption, so you don't need to give up coffee completely. Just keep it sensible. Is alcohol allowed during the fertile period? Occasional light drinking is unlikely to stop pregnancy from happening. However, Regular or heavy alcohol intake can reduce fertility in both men and women. So the advice is again moderation, not panic, and definitely no binge drinking when trying to conceive. Do painful periods indicate a fertility problem? Painful periods are not normal just because they are common. Mild discomfort is really fine, but severe pain that affects daily life can indicate conditions like endometriosis. Not every woman with painful periods has fertility issues, but persistent or worsening pain should never be ignored. Does heavy bleeding mean a healthy uterus? No, heavy periods do not mean a stronger or healthier uterus. In fact, excessive bleeding can be a sign of fibroids, hormonal imbalance, or other uterine issues. So flow quantity does not equal fertility strength. Is intercourse after ovulation useless? I wouldn't say it's useless, but chances definitely do drop. The egg survives only about 12 to 24 hours after ovulation, while the sperm lives longer. That's why intercourse before ovulation matters more than after. Are ovulation apps accurate? Ovulation apps will give estimates, not guarantees. They assume that ovulation follows a predictable pattern, which isn't always true. Apps are helpful for awareness, but if pregnancy isn't happening, they shouldn't be relied upon blindly. Does watery semen mean poor fertility? Not necessarily so. Semen appearance does not reliably reflect sperm count or quality. The only way is to do a proper semen analysis. If erection and ejaculation are normal, does that mean sperm count is normal? No. Sexual performance and sperm quality are entirely two different things. A man can have normal erections and ejaculation, but still have abnormal sperm parameters. And that is why testing matters. How long should we keep trying naturally before seeing a doctor? If the woman is under 35 years of age, we usually advise trying for 1 year with well-timed intercourse. If she's 35 years or older, it's about 6 months. And if cycles are irregular, periods are painful, or there is a known medical issue, you should come earlier. This isn't rushing treatment, it's respecting time. Do sexual positions affect the chances of pregnancy? No. There is no scientific evidence that any sexual position improves the chances of pregnancy. Sperms will reach the mouth of the womb within minutes, regardless of the position. So comfort matters far more than technique. If semen leaks out after sex, does that reduce chances? Absolutely not. This is a very common worry. What leaks out is mostly the seminal fluid, not the sperms. The sperm that matters has already entered the mouth of the womb within minutes. Should the woman lie down or raise her legs after intercourse? There is no strong evidence that lying down or raising the legs improves pregnancy chances. Sperms move very quickly and don't depend on gravity. If you think lying down feels more comfortable, that's fine, but it's not mandatory. Does the female orgasm increase the chances of pregnancy? Absolutely not. Pregnancy does not depend on the female orgasm. While orgasms may enhance pleasure and bonding, it does not determine fertility outcomes. Conception is about timing and biology, not about an orgasm. And the last one, is daily intercourse better than alternate day intercourse? Daily intercourse is fine, but it's not superior. Alternate day intercourse during the fertile window gives similar pregnancy rates and is often giving us better sperm quality. So, don't exhaust yourself. Regular and well-timed intercourse is enough. If you have any more questions related to timing, myths, fertility, intimacy, or anything surrounding the baby making process, drop it in the comments below and I'll come back with another reel and a video regarding the same.